Yes.
He's 74. He's in good shape.
Yes.
He feels lousy, and he always says, hey, if you live long enough,
Yes.
your body starts breaking down.
Certainly.
And so when you hear them say that, it's just part of age. So you don't believe that? It doesn't have to be that way?
No, it does not. No. This is what conventional medicine wants you to believe, that this is part of normal aging, but it's not. It's unacceptable.
Do you think you're going to live to be 120?
I
Possibly?
don't know. It'd be nice if we...
But you think over 100? I mean, is that the goal here?
Oh, certainly. Well, we have already centurions, right, that live over 15 years old.
But at 90 years old, the quality of life is pretty bad. You're saying
yes.
you start early. Or you're not saying,
yes.
I'm putting words in your mouth here, but
certainly.
Is this what you're saying, though, or your belief?
Oh, yes, definitely.
That if you start in the 60s, 50s,
yes,
that you can slow the aging of the organs.
Sure. Well, it's good to start quite early as you can. Maybe I would say both men and women in their late 40s.
Okay.
Even 40, I have patients in their late 30, 35, 36.
And these are highly functioning people.
Highly functioning.
CEOs.
Yes.
Celebrities.
Celebrities.
How do they hear about you, by the way?
Oh, they'll see from word of mouth, and from my website. So, and of course, I get patients from all over, not only just the U.S., but it's international. So this is what people yearn for.
And not everybody's doing it the same way, by the way.
No.
I interview a lot of doctors, and I try not to put my own views on the show at all.
Yes.
But what's distinctly different with your program is you're big on nutrition.
Yes.
And you are big on stress reduction.
And exercise. And supplements and exercise.
The right kind, though.
Right, exactly.
And I know your age, by the way. You say you live this. You're very lean. You're in great shape.
Well,
you look at least 10 years younger than your age. You think it's because of hormone optimization?
I think
and because of the way you eat, or is that just good genetics?
No. I mean, no, not. I think the main thing is the lifestyle. I'm sorry. My lifestyle. So it's about nutrition, fitness, hormone optimization.
Is it easy, by the way? Because don't we all know what we should do? We can't do it. Most of the time.
Right. Behavioral change is another aspect of this. So people need, because we know what's good for us, most of us, right? So it's a behavioral aspect.
What's the number one thing that they say? The biggest thing?
Yeah, well...
What do they say?
Yeah, in 7 to 10 days...
they say, Dr. Peters, what?
They
what do
they say? Women, no hot flashes anymore, no night sweats. They feel more energy. They start going to the gym, doing more than they did because they realize they have more energy. So the outlook on life is much more...
How do they become more positive? Just because they have more energy? I mean, does it work with neurotransmitters?
Yeah, I think it's all within the whole process, of hormone. Once you have optimized your hormones, you optimize your neurotransmitters, the thyroid, the adrenals, all your organ functions better. So it's a given that you'll feel much
And this is
better
a big
and function
topic.
better.
This is a big topic. We said, and we're going to take a quick break. You said, it's such a big topic. I don't know how we're going to get this in. But obviously you can't get it all in. When we come back from the break, I want to talk about the commonly replaced hormones, what they're good for. I have questions about testosterone, thyroid, progesterone, estrogen, and growth hormone.
Yes.
Because I've heard a lot of negative things about it. You say it can be good in the right dose.
Sure.
With the right candidate.
Sure.
Okay. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. The next segment, we're going to talk about hormone optimization. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about hormone optimization. With us, we have a leading expert on the topic, trained in France and Italy, and of course here in the United States. With us, we have Dr. Ann Peters. Okay, so people are coming from all over the country. They want to feel better.
Yes.
More energy.
Certainly.
You say that you don't have to age and just slowly wither away.
That's right.
Okay.
Yeah. So
you could stop that. Of course, I'm a little skeptical.
Sure. Well, we have the ability these days with all the new technologies, one including hormone replacement, to feel the best we can. So we optimize our hormones to their optimal levels, actually, so that we kind of mirror the levels we had in our 20s and 30s.
Okay, so you take somebody in their 60s, you replenish their hormones to that of a
30-year-old.
30-year-old.
Yes.
So without even looking at blood work, so I understand this correctly, is your philosophy, the age management philosophy, that basically after 40, no matter what, you're in hormonal decline.
Levels decline.
So
yes.
by giving those back, you feel the benefits.
That's right.
Of that. Of course,
age,
if you eat
that's
right and things like that.
Certainly, we age because our hormone levels decline. That's why we age. So if we replace our hormones and optimize them, then it goes without saying that we feel much better, and we would kind of avoid or stave off the disease, the diseases that occur with age.
You say the second
time.
half of life absolutely should be the best half of
That's
life.
right.
I mean, you're obviously smarter.
That's right.
After 50.
That's right. That's right. We should have better cognition, memory.
Really?
Focus, concentration. Yes.
Those things come back.
Definitely. Oh, yes. Many of my patients feel much better. I have a lot of students that have even, patients that have even gone back to school.
Do they ever say, you've given me my life back? As cliche as that is.
Oh, definitely.
Do they say it?
Definitely. Oh, you have countless patients who, they feel so much better, and they function, and they cannot believe how they felt before they started.
Okay.
And this is how they feel now.
Good. Well, let's talk about the commonly replaced hormones. What are you looking at?
Well, I look at all the hormones. For instance, thyroid. Okay, it's very, very important hormone because it orchestrates everything that happens in our body, all our metabolic processes. So thyroid is very important. We look at the adrenals, cortisol, DHEA. And we look at the sex hormones, which are testosterone for men and women, estrogen and progesterone. We look at things like pregnenolone, melatonin. All of those are important. Even, aldosterone. There are so many hormones. Insulin.
Okay.
That
Growth
are very
hormone.
important. Growth hormone.
Hot topic.
Pretty much, yes.
And that's on your more advanced program.
Yes, exactly.
Let's just suppose somebody's a candidate.
Yes.
Low growth hormone levels.
Right.
Is that something you do once they're balanced? When do you bring it in?
I could give a patient growth hormone in the very beginning. It's not. I don't look at it as you do one hormone here in beginning, and in 3 months you do another hormone.
Okay.
We are going to comprehensively replace the hormones if they are a candidate and if they need it. Okay, so there are certain people who are not candidates for growth hormone for very reasons.
But the ones that are, what's it good for? What's it good for?
Question is, what is it not good for?
Okay.
For
so skin,
the external appearances, tone, color, texture of your skin improves.
Women are doing this.
Oh, certainly. I have people who haven't seen their friends for a long time, and they look at them and say, "What are you doing?"
But you're not going to get big with growth hormone?
No.
Okay.
No, because
is that a misconception?
That's because people abuse anything, right?
So too much, you can
too
get in
much.
trouble.
So
okay.
So I do it at a very conservative dose and optimal dose at the same time, so you see the benefits you're looking for.
I've heard Hollywood celebrities have embraced this.
Yes.
This is a big secret little group of people that do hormone balancing, hormone optimization.
Right. Well, it makes them perform better because they are very high functioning people, right? So they want to feel better and do the schedules, keep on their schedules that they need to. So like other professionals. So it helps us internally too. Getting back to that, the cardiac muscle works better. The lungs, your spleen, liver, everything works better. All your organ systems works better because of growth hormone. And also, the very important thing as people get older, they think of memory, cognition, functioning and concentration, focus. So that's very important to keep their mental sharpness as they get older.
So people that have a partner, one goes in.
Yes.
They do the program.
Yes.
They feel so much better.
Right.
Do they usually go and drag their partner in?
Oh, definitely. I see it all the time.
This is what happens all the time.
Yeah, either they come in together initially, or one person starts and then they say, "Oh my gosh, I think my wife or husband could use this," and they bring them in. It used to be more women coming in initially, but now men are coming in and bringing their wives in.